I'd also like to felicitate our co-chairperson, Dr. Abhishek Bhattacharya. Okay, so thank you. So moving to our next session, we have Dr. Debashish Pahari, R&D head.
Good afternoon, everybody. I know you are facing with the Tiksnaksni to Bhassakagni because all are too much hungry. I am also hungry. But I will not take so much of time because already management has given me only 15 minutes time. I will conclude this session within this duration. Before starting this session, Before starting this session, I want to say something because since morning onwards, I am observing that we are discussing about the Ayurveda principles, Ayurveda treatment and everything. But I will discuss something different, because if we consider this, that if the Chikitsa is Chotuspat, Rogi, Bhisak, Bhesaj, Upasthata. And I am in this concern that is dealing with the Bhesaj. Bhesaj means medicine. And this medicine is so much important because if you think about this, suppose Ayurveda is a temple. If you consider the temple, every speakers have discussed about in the temple, the mantra and everything in the morning session. But marketing is the most important part. Suppose on the way, if you see that any temple, and if it is well furnished and well decorated, then we will give some donations and everything. That marketing is most important. Anywhere marketing is most important. Without marketing, nothing can be happen. And for this, any industry, any pharmaceutical industry, they used to do the marketing, and also marketing one of the part, because I am saying that in the year 2019, I had given some lectures in California, NAMA conference. I said that the topic was that Ayurveda and the mind. And I said that the Ayurveda and the mindset should be most important part. Suppose we are manufacturing the Ayurvedic medicines and for the treatment of the patient. If the quality of medicine is not proper, that purpose will not be served properly. This is most important part, and I will explain. I am Dr. Debashish Pahari. I am with Baidyanath last 23 years as R&D head, and I will explain the recent scenario, the R&D development in the India and also the abroad, and also the part, the government support, and some part of the commercial part, that is the contribution of Baidyanath regarding the development, R&D development of Ayurveda. The call of the hour, the key focus of R&D, the bridge gap between the ancient knowledge and the modern pharmaceutical science, rising global interest, alternative natural medicine focusing holistic, preventive and healthcare. And regarding this, I am saying you, the global interest is rising gradually. And I am saying you that is 19.38% the growth rate in the modern medicine, that modern in the globalized Ayurveda. And modern research and development is essential for validate the Ayurvedic products for efficacy, safety, and global standardization. This is most important, global standardization. The evolution of R&D and pre-20th century, the reliance, traditional practice, knowledge gathered from the ancient Ayurvedic text, which is the minimal formal research. In that time, the Dadima's recipe is also important part. And post-independence, the CCRS formed CCRS. This is also a research organization in Ayurveda. Next 21st century is the significant initiatives to regulate the Ayurvedic R&D and formation of Ministry of Ayush in 2014, increasing government and private sector interest, standardizing the formulation and conducting the clinical trials to meet the modern scientific standards. There are more Ayurvedic research centers right now than at any time in the history of the world. The scope of R&D in the Ayurvedic pharmaceuticals, the standardization and quality control, established the uniform standard of raw material sourcing and product manufacturing. That raw material is part of good agricultural practice. We consider that GMP and good agriculture practice is the part of the standardized raw materials. Efficacy and safety of safety studies, clinical trial to validate the therapeutic efficacy and safety of the Ayurvedic formulations, assessment of toxicity levels, bioavailability, and pharmacokinetics. Pharmacology and formulation development, converting the traditional Ayurvedic compounds into the modern forms like tablets, capsule, and syrups. Previously, it was some paste form and it's a traditional method, and it's a standardized format. And phytochemistry and active compounds identification, focus on the identifying bioactive compounds in the medicinal plants, integrating the nanotechnology and biotechnology into the Ayurvedic products. This is most important part, the nanotechnology and biotechnology into the Ayurvedic products. Biotechnology application and molecular biology, genomics to isolate the understanding active plants-based compound and Ayurvedic herbs, their therapeutics and therapeutic properties, that biotechnology concept and nanotechnology concept, especially in the Bhosmos, and exploring the nanoparticles based drugs efficacy system and enhancing the bioavailability and efficacy of the Ayurvedic medicines. Also, this is most important part, the integration of modern science in the artificial intelligence. This is the recent scenario, use of AI, the big data Ayurvedic research to predict the therapeutic efficacy, optimize the formulations and personalized treatment, especially in the Trividha Parikha, Dasavidha Parikha, so many examinations is there. And pharmacovigilance, monitoring the adverse effect of drug, effect and drug interactions, patients using the Ayurvedic medicines through advanced software system. And government support initiatives, the Ayush, Ministry of Ayush, they are supporting, promoting the Ayurveda in last 10 years, and a huge promotion of Ayurveda. CCRS and AIA, that Central Council of, for Research and Ayurvedic Science, and Institute of, that All India Institute of Ayurveda, they are doing the clinical research and drug development. National Medicinal Plant Board, they are looking after this, the quality of herbs, the development of herbs, and they are also integrating so many new herbs also. They are trying to do the stevia, like that of stevia. Stevia is very effective. The sugar supplement, they are also trying to integrate in this, in the Ayurvedic system. Because in the Ayurvedic classics, you will not see any type of stevia. It's not, you will not see anything. And they are also trying to do it. Financial scheme and funding initiatives for Ayurvedic R&D, that extramural research is EMR. This is also important. And Ayushman Bharat is also incorporated with the Ayushman Bharat, and also extramural, the collaboration with the government along with the different industry, they are doing this. The personalized Ayurveda, leveraging the genomics to create the individualized Ayurvedic treatment based on the person's genetic makeup. It's also important, person's genetic makeup, and it's not generalized. And Ayurvedic nutraceuticals is also an important part, rising trend of developing food supplements based on the Ayurvedic ingredients, appealing to the health consciousness and consumers globally. This is also important because why I'm saying, because nowadays also we are selling these Ayurvedic medicines. Unfortunate is that we are selling as a Ayurvedic food supplement or herbal supplement. It's not a medicine. This is also same for us. We are promoting Ayurveda. We are saying that we are good, we are the best. But unfortunate that we are selling Ayurvedic medicine not as a medicine. It's a food supplement. This is also a challenge for us also. The future trends of Ayurvedic R&D, expansion of global market, this is also important, eco-friendly and sustainable practice. And this is also related to the Baidyanath. What is the contribution of Baidyanath in the Ayurvedic era? Lauded by the many luminaries of India for its effort to benefit of people today, Baidyanath stands as one of the largest manufacturer of Ayurvedic medicine. We are manufacturing more than 1,000 medicines. Previous Prime Minister like Sri Lal Bahadur Shastri, Srimati Indira Gandhi specifically recognized the contribution of Baidyanath to providing direct or indirect employment to millions of people in the country. The historical legacy, our first President of India, already this is his message. We have got the 2 times Nagarjuna Award in the year 2005 and 2009 for the best quality medicine in Ayurveda. Our founder, Mr. Ramdayal Joshi, with Pandit Jawaharlal Nehru, our first Prime Minister, with Sri Lal Bahadur Shastri, our Prime Minister, former Prime Minister, Indira Gandhi at our Baidyanath factory, Atal Bihari Vajpayee at our Baidyanath factory, and last year, probably in 2022, endorsed by Prime Minister Mr. Narendra Modi in a social media and his televised speech, where he asked the people to increase their immunity by adopting the guidelines issued by the Ayush Ministry. Baidyanath R&D setup, I am just exploring something. The recent research, this is the R&D setup. Our latest innovations. The latest innovations is CalciGuard. It's completely natural and calcium-based ingredients, based with the calcium-based ingredients. It's also clinical trial going on in this college in the last stage. It strengthens bones, supports speedy recovery of bones, joint injuries, and it is full of harjod. Dose is 2 tablets twice daily. List of some clinical trials. The report of clinical trials of Chyawanprash by me and also some of my colleagues, and that clinical trial on diabetic gut granules, it was done in Institute of Postgraduate Ayurvedic Education and Research, Government of West Bengal at Calcutta. Easy Slim also in SBAP Hospital in Government of West Bengal under the guidance of Dr. B.P. Sahu, Dr. Tripathi and Dr. N. Kanjiral. Live Good capsule, this is from Institute of Postgraduate Ayurvedic Education and Research, and Nimgard is from also same from Postgraduate and Ayurvedic Research from Calcutta. Pyroids, this is same institute. Prostate, this is also same institute. Stress guard, also same Postgraduate Institute of Ayurvedic Education and Research. Dr. Hani, also same institute. Vigor and Stamina, this is from Gopabandhu Ayurved Mahavidyalaya in Puri. Earth Plus is also same under the guidance of Dr. Debaprasad Das, Saurabh Nayak and Dr. Sushant Sahu at Gopabandhu Ayurved Mahavidyalaya Puri. Coalesced guard is also done from the Gopabandhu Ayurved Mahavidyalaya Puri. Baidyanath Ayush, this is latest clinical trial under the from this institute under the guidance of Dr. Ranjan Kholita, Professor Pranab Jyoti Vaishya and Aditi Acharya. And at the Kalsighat, the trial is going on. And today morning also I have discussed with Principal Sir, and we are planning to do more 4 clinical trials in this institute, and we will start from December onwards. And we have the chain of clinical trial data, and we will inform accordingly. The conclusion, opportunities, and way forward. Rapidly evolving with the growing government support, private investment, and scientific validation, emphasis on the evidence-based research to establish the Ayurveda place in the modern healthcare globally. Opportunities. What is the opportunity? Increasing global demand for the natural plant-based medicine opens new market for the Indian Ayurvedic companies. That's why I'm saying that, because in the global market, the percentage of the modern medicine, the growth rate of modern medicine, only 10.72%. But trend is that in the global market as well as Indian market is 15.38%, and global market is rapidly growing, that is 19.38%. And one thing I am saying, Dr. Nayak emphasis in the morning, that point is that in the treatment, 50% people used to do that common treatment and on the folklore, and also the home remedies like that Dadima's recipes and previous concept. But this is true. What I am saying, because as per Johnson Nicholson report, they used to do the CAGR report, and also the market research. It's a renowned organization all over the India, not only in India, it's all over the world, Johnson Nicholson. As per their survey, you will be surprised that only 24% people go to the doctors for their treatment. Not only that, it's in the modern medicine. And in the Ayurvedic scenario, I have doubt, there is no data, but I have doubt less than 5% is they go to the doctor. Only through prescription, they used to treat their problems. But also, I have already observed, I have done so many research work, market research, that if you go to the Ayurvedic medicine shop, end of the day, if you ask the total sale, the today's sale, if you ask them, they will say 95% of total sale from the frontline sale. Only 5 to 6% sale from the direct prescription sale. This is the scenario. And Ayurveda is alive only on the 95%, that is the frontline seller. They have to train properly, and this is the practical scenario. We'll discussing so many scientific seminars, so many things but this is the practical scenario of the Ayurvedic market in the India. Thank you all.
Thank you, Dr. Debashish Pahari sir, for your deliberation on R&D scene of the Indian Ayurvedic pharmaceutical industry. Now I would like to request President of this seminar, Professor Dr. Hogan Bosumotari sir, to felicitate Dr. Debashish Pahari sir with a certificate, Pholam Gamusa and kit. So thank you, sir. Thank you. So now the session is, there is a break, sessional break for half an hour, lunch break. We will again assemble after half an hour. So thank you.
नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभम करिष्यामि प्रसन्नां भव सर्वदा. हरि ओम. Again, we are meeting for the next session, and that is shoulder joint. So, forget it. These are some workshops we take, but that is not the main thing. Let us start with case number 1. Male, 55 years old. He is a painter by profession. He is having sharp and pinching pain with overhead shoulder movements, unable to sleep at night on affected site, and he is having no radiographic changes. What is the diagnosis? Can any one of you tell me what is the diagnosis? Male 55 years old comes to you, and without radiographic changes, there is severe shoulder pain. This is known as subacromial bursitis. Okay, this is a kind of bursitis. Do you know what painful arc syndrome is? Painful arc syndrome is, let the patient get straight, okay? First 15 degrees, there is no pain. After 15 to 20 degrees, there is pain. Again, last 15-20 degrees, there is no pain. So, this is a painful arc. Okay? First 20 degrees, there is no pain. There is pain. Again, last 20 degrees, there is no pain. So, there are 4 or 5 different diagnoses related to it. Diagnosis may be intra-articular pathology or extra-articular pathology, or there will be systemic pathology also. Like say, if it is an autoimmune disease like rheumatoid arthritis, then it is a systemic pathology. If a patient is having subacromial bursitis, it may be extra-articular pathology. If it is, say, adhesive capsulitis, it is intra-articular. Adhesive capsulitis is avabahuk. So there are so many things related to it, but we have to be cautious about extra-articular pathology, intra-articular pathology, and systemic pathology. In subacromial bursitis, you have to stand behind the patient. Don't see the shoulder joint from this direction. Go just beyond him, go just behind the patient, and then you can examine the patient's shoulder joint. So this is the right position. What is tendon? What is tendon? See, it is inelastic cord. It attaches muscle to bone. Inelastic cord, muscle to bone, and it serves to move the bone or structure. Remember one thing, tendon resembles like kandara or sira, and it is upadhatu of rakta. Okay? So whenever a patient comes to you and in opposite to gravitational force, if he is moving his leg or he is moving his joint opposite to gravitational force, he is moving his joint, and if pain is there, it is tendinitis. See, I am climbing up the stairs and I am getting knee pain, I am having tendinitis. If I am going down from stairs, and then I am getting knee pain, I am having osteoarthritis. Okay? Climbing up, getting pain, tendinopathy. Going down, having pain, osteoarthritis. Got it? So, what is tendon? It is kandara or sira, upadhatu of rakta. What is ligament? See, it is fibrous connective tissue. It is bone to bone. It holds the structure and keep them stable. So it is fibrous structure. It is non-elastic. One is elastic, one is non-elastic. One moves, one holds. Okay? So it resembles like snayu and it is upadhatu of meda. So in ligament injuries, you have to think of meda. Muscles is peshi. Bursa. What is bursa? It is just a cod liver oil tablet होती है ना, that type of structure it is. It is to avoid friction in movements of tendons especially. So it resembles like what? See, it resembles like picha. It is there in Samhita. So where it is? Charak Sutrasthan 28, Adhyay 28, Charak Sutrasthan 28. It is written here that आहार रस के दो पार्ट होते हैं, प्रसादाख्य एंड किट्टाख्य. तत्र आहार प्रसादाख्यो रसः किट्टम च. ये दो पार्ट होते हैं. किट्टात, किट्ट से क्या बनता है? किट्टात स्वेद मूत्र पुरुष वात पित्त श्लेष्माणः कर्णाक्षी नासिकास्य लोमकूप प्रजननमलाः केश श्मश्रु लोम नखादयश्च अवयवाः पुष्यन्ति. किट्ट से इन चीजों का पोषण होता है. अभी पुष्यंती तो आहार रसात. हाँ, आहार रस का जो प्रसादाख्य भाग है उससे क्या होगा? रस रुधिर मांस मेद अस्थि मज्ज शुक्र ओजांसी पंचेंद्रिय द्रव्याणी धातु प्रसाद संज्ञकानी. एंड नेक्स्ट लाइन इज वेरी इंपॉर्टेंट. शरीर संधि बंध पिच्छादयश्च अवयवाः पुष्यन्ति. आहार रस के दो भाग हुए, किट्टाख्य प्रसादाख्य. प्रसादाख्य भाग से शरीर संधि बंध पिच्छादयश्च अवयवाः पुष्यन्ति. दैट पिच्छा इज बर्सा. सो थिंक अकॉर्डिंगली. अस्थि, synovial membrane is श्लेष्मधरा कला, as we all know. संश्लिष्टः श्लेष्मणः तथा. I am going little bit fast. Cartilage. So what is cartilage or meniscus? So cartilage resembles like, I am not going into details of it. It resembles like med, majja and vasa. It is a combination of med, majja and vasa. What is picha? It is bursa, snayu, ligament. Okay? You are getting my point? Okay. So these are some combinations related to rachana. So if a patient comes to you with tendon related pathology, go ahead with Kandara Sira. Think of Rakta, give treatment according to Rakta Dhatu. If a patient comes to you with, say, bursitis, think of Picha and give treatment accordingly. So, this way we have to think. Now, if I have to treat tendon, what are the different drugs related to it? Are there any drugs related to it? So, how to derive these drugs from our basic Samhita? First, I will show you derived drugs. These are some drugs. It is not important, but important is how to derive it from Samhita. How to derive it from Samhita? Let me tell you. See, first, I jotted down all the dravya related to Katishul. So there are 73, 72, 74 dravya related to Katishul in Bhava Prakash. Okay. Now, if a dravya is having Katishul plus Sthaulya in its shlok, then Sthaulya, if it is Sthaulya, it is related to Med. So, in Katishul, if Snayu related problem is there, go for Katishula Hara plus Sthaulya Hara Dravya. and that is Shigru, Guggul, Nirgundi, etc. If a dravya is having, say, Rogagnata, in which Rakta Pitta plus Katishul is written, then think of tendon related pathologies in low back pain in of that particular dravya. See, if it is Ashwatha, you can think of tendinopathy at low back pain and give Ashwatha. You can think of Bala, you can think of Shatavari in tendinopathies related to Katishul. Now, if it is bone related pathology, there are these type of dravya are there. So, important is not list of medicine. Important is how to derive it from Bhav Prakash, how to derive it from Sharangdhar Samhita. It is what is more important. So, see, in Sandhigata Vat also, the Chikitsa Sutra is Sneha, Upanaha, Agnikarma, Bandhana, Unmardanani cha. So, in every case, I have to use these things randomly, or is there any protocol? So, if a Sandhigata Vat patient comes to you having pathology related to tendon, go for Snehan Bandhan Lep. That's it. If a patient of Sandhigata Vat having Peshi or having, say, Kandara or Sira as the involvement, then think of Snehan, Upanaha, Agnikarma, Bandhan, etc. So these are permutation combinations. In some cases, you have to just use Bandhan. In ligament injury, just use Bandhan as first line of treatment. Every time Bandhan won't work, but in many cases it will work. Every time Agnikarma won't work. But in specific clinical conditions and specific avayav vichar, you can use it very precisely. Acha, are you getting my point? Good. Madam, समझ में आ रहा है? So, ये जो ब्लैक कलर के हैं पहले, अस्थिगतवाद, अस्थिक्षय, अस्थ्यावृतवाद, ये जो फर्स्ट थ्री है, इट इज रिलेटेड टू अस्थि रिलेटेड पैथोलॉजी. So we have to treat अस्थिक्षय in these cases. अस्थिगतवाद, अस्थिक्षय, अस्थ्यावृतवाद. Sandhigatavat, Vatarakta, Amavatta, these three are systemic disorders of, shoulder joint. And these three things, Avabahuk, Amsashosh and Vishwachi, are intra-articular pathologies of shoulder joint. So intra-articular pathologies, extra-articular pathologies and systemic pathologies. These are three things related to it. So in shoulder joint, there is not only Avabahuk, which is mandatory, these 9 things are mandatory. So if a patient comes to you with, say, Asthigatavat, Mausa Balakshayaha, and patient tells you, Aswapnaha, Neend nahi aati. Neend nahi aati. There are 2 types of neend nahi aati. One is patient goes to bed at, say, 10 o'clock or 11 o'clock at night and he can't sleep up to 2 o'clock. करवट बदलते रहता है. And if the diagnosis is not PAR, the next diagnosis is depression. ठीक है? आप थोड़ा हंस लिया करो. It was a joke. ठीक है? Next is, अगर पेशेंट सोता है 10 बजे और 2 बजे उठता है और 2 से 4 बजे तक वो जगह है, वो ये नहीं कर सकता, सो नहीं सकता, then the pathology is related to ग्रहणी. Remember these things. एक है वो शारीर कारण है, एक है वो मानस कारण है. पेशेंट सो नहीं सकता 2 बजे तक, तो इट इज मानस हेतु मेनली. और पेशेंट जो 2 बजे उठ जाता है, शारीर हेतु. सो दिस 2 things are there. Remember this thing in your mind when you are treating a patient. पेशेंट को आपको पूछना पड़ता है कि आप क्या बोल रहे हो, कितने बजे आप नींद में कितने बजे आपको नींद आती है, कितने बजे उठते हो, तो पेशेंट विल टेल यू इन डिटेल. ओके. अस्थि क्षय, यहाँ पे देखिए, अंग भंग एंड वचने कठोरता. अस्थि क्षय में वचने कठोरता है. एक आपका पेशेंट है और उसकी औरत या उसकी वाइफ कहती है, डॉक्टर कुछ भी कारण नहीं है, ये अचानक चिढ़ते हैं हमारे ऊपर, शाम को घर आते हैं, बैग फेंक देते हैं और जोर से चिल्लाते हैं, टीवी बंद करो पहले. आने के तुरंत बाद विदाउट एनी रीजन वचने कठोरता, विटामिन डी डेफिशिएंसी, अस्थि क्षय. यू अंडरस्टैंड? डू यू अंडरस्टैंड? गुड. अगर आपके पिताजी या आपका जो भी कोई है घर में, या कोई भी मेल फीमेल व्हाटएवर, वो अचानक चिढ़ने लगे और अचानक देयर इज नो रीजन फॉर इट, तो आप और बोले रात को कहते वो नहीं यार ये सिर दुख रहा है या ये यहाँ पे दुख रहा है, बहुत ज़्यादा दुख रहा है, देन इट इज़ अस्थि क्षय. एंड ट्रीट इट विथ, से एलोपैथी में है तो ट्रीट इट विथ विटामिन डी और वॉट एवर यू लाइक टू ट्रीट. इंपॉर्टेंट इज डायग्नोसिस. यू आर गेटिंग माई पॉइंट. आप में से कितने लोग पहले लेक्चर में थे? ठीक है. कितने लोग नहीं थे? वेरी गुड. तो यार वो तिक्तक्षीर बस्ती वाला हमने मिस किया. तो उसमें स्निग्ध शोषण खरत्वम उत्पादयति तदस्नो वर्धनम युक्तम, ये एक बहुत अच्छी लाइन आचार्य वाग्भट ने कही है. वो है उसमें अस्थिवर्धक द्रव्य क्या है, तो वो इसमें दिए जाते हैं. तो रिमेंबर वन थिंग, अस्थि क्षय रहा तो ट्रीट इट अकॉर्डिंगली. अस्थ्यावृत्तवाद, इसमें सूचिभिरीवत उद्यते, जोर से ऐसे प्रिकिंग पेन इसमें दिखाई देता है. संधिगत वात रहा तो उसमें आम पच्यमान पक्वावस्था, उत्तान वात रक्त, गंभीर वात रक्त, ऐसे अलग अलग ये दिखाई देते हैं. इसमें और एक था, ठीक है. विश्वाची, अवबाहुक, आमवात और अंशशोष, ऐसे 4 अलग अलग आपको ये मिलेंगे. कर्म क्षयकरी विश्वाची, अवबाहुक में शोष संकोच शूल रहेगा. इंट्रा आर्टिकुलर पैथोलॉजी रही, ध्यान से सुनिए, वो सब फोटोग्राफ बाद में करूँ, ध्यान से एक बात सुनो. इंट्रा आर्टिकुलर पैथोलॉजी रही तो सभी जगह रिस्ट्रिक्टेड मूवमेंट्स रहेगी, यूनिफॉर्मली रिस्ट्रिक्टेड मूवमेंट. कैसे? मैं यहाँ से हाथ उठाता हूँ तो यहाँ तक उठता है, यहाँ से इतना ही, यहाँ से भी उतना ही. यूनिफॉर्म रिस्ट्रिक्शन ऑफ मूवमेंट, इंट्रा आर्टिकुलर पैथोलॉजी. एक ही पर्टिकुलर मूवमेंट पे मुझे बहुत पेन है, एक्स्ट्रा आर्टिकुलर पैथोलॉजी. फॉर एग्जाम्पल, मैं एक पेशेंट हूँ, आप हाथ ऊपर करो, मैंने किया, आप सभी लोग करो, ऐसे थम्स अप करो, थम्स अप, ऐसे मुझे अंगूठा दिखाना है, ऐसे दिखाओ, दिखा. अब ये नीचे करो. पेन हुआ किसी को? शोल्डर जॉइंट में किसी को पेन नहीं हुआ? एनीबडी इन द हाउस? नो. हुआ? सुप्रास्पाइनेटस टेंडिनाइटिस. This is supraspinatus tendinitis. This is extra articular pathology. And remember one thing, it is very easy to treat. सिर्फ ऐसी मूवमेंट पे उसको पेन पेशेंट को हुआ, एक ही मूवमेंट, बाकी वो यहाँ पे कर सकते हैं, यहाँ पे कर सकते हैं, बाकी हाथ हिला सकते हैं, सब कुछ कर सकते हैं. एक पर्टिकुलर मूवमेंट में वो पेन सह नहीं पाते, दैट इज एक्स्ट्रा आर्टिकुलर पैथोलॉजी. इट इज़ वेरी इजी टू ट्रीट विद द हेल्प ऑफ लोकल प्रोसीजर्स लाइक अग्निकर्म, विद्धकर्म या उपनाह स्वेद एक्सेट्रा एक्सेट्रा. सो शोल्डर जॉइंट का पेशेंट आपके पास आए तो एक्स्ट्रा आर्टिकुलर है कि इंट्रा का आर्टिकुलर, इतना ध्यान दीजिएगा. सर कितना टाइम है अभी? कितना टाइम है अभी? कितना? चालू रखूं? 15 मिनट्स? 15 मिनट्स. वो ठीक है. ये अभी मैंने जो पेनफुल आर्क सिंड्रोम बोला, उसमें 5 अलग अलग पैथोलॉजीज आती है. One is incomplete tear of supraspinatus, supraspinatus tendinitis, calcified deposit in supraspinatus, subacromial bursitis and crack fracture. ये पांचों आप ट्रीट कर सकते हो. You need not have to send this patient to anybody. आप ये आपके शोल्डर क्लिनिक में ये सब कर सकते हो. तो इसीलिए ये करना चाहिए. जैसे मैंने सुबह बताया वो मैं वापस बोलना चाहूँगा. प्रत्येकम स्थान दूष्यादि क्रिया वैशेष्यम आचरित. इंपॉर्टेंट इज स्थान इन वातव्याधि. इंपॉर्टेंट इज स्थान. हाउ मेरे पास स्पॉन्डिलाइटिस का पेशेंट आता है. इफ इट इज सर्वाइकल स्पॉन्डिलाइटिस आई विल यूज रुक्ष एंड उष्ण चिकित्सा. If it is lumbar spondylitis, I will use snigdha and ushna chikitsa. Why? ये वात स्थान है, so I will use snigdha and ushna. ये कफ स्थान है, so I will use ruksha and ushna. पर संधि, any संधि is श्लेष्मज, कफज है. पर फिर भी इसका जो तारतम्य है, तरतम भाव है, उससे ट्रीटमेंट चेंज होती है. गुणों की ट्रीटमेंट भी चेंज होती है. ये हमेशा याद रखें. सो स्थान इज इंपॉर्टेंट. नेक्स्ट इज दुष्य. दुष्य इज ऑल्सो वेरी इंपॉर्टेंट. रक्तपित्त में आप पाक देखते हो धातुओं का. प्रमेह में आप शैथिल्य देखते हो धातुओं का. ऐसे धातु क्षय दिखाई देता है. धातु वृद्धि ये स्थौल्य में दिखाई देती है. तो उस हिसाब से ट्रीटमेंट फॉर्म्स बदलते हैं. सो धातुओं में क्या फर्क पड़ा है व्याधि होने के बाद, व्याधि होते वक्त, उस हिसाब से हमें ट्रीटमेंट प्रोटोकॉल्स ये चेंज करने पड़ते हैं. सो क्लिनिकल कंडीशंस, इनकम्प्लीट टेयर ऑफ सुप्रास्पाइनेटस रहा तो इसमें फर्स्ट इज यू हैव टू डू अग्निकर्म. अग्निकर्म में मैंने जैसे कहा रजत या रौप्य या सुवर्ण शलाका से आपको अग्निकर्म करना पड़ेगा. नस्य और औत्तर भक्तिक स्नेह ये बहुत इम्पॉर्टेंट ट्रीटमेंट्स है. नस्य, ब्रूहण नस्य अगर आप करते हो तो उसका बहुत अच्छा रिजल्ट ये देखा जाता है. और उसके साथ आप औत्तर भक्तिक स्नेह इज खाने के बाद आपको स्नेहपान करना है. बहुत वात प्रकोप बहुत ज़्यादा है तो कम समय के लिए ज़्यादा मात्रा में आपको तैलपान करना है. अगर कम वात प्रकोप है तो ज़्यादा दिनों के लिए कम मात्रा में घृतपान देना है. ज़्यादा मात्रा में कम समय तेलपान, कम मात्रा में ज़्यादा दिनों तक घृतपान. याद रखो ये सिंपल है, एकदम सिंपल है. क्योंकि रक्त दुष्टिकर होता है तेल, इसीलिए वो ज़्यादा दिनों तक नहीं दे सकते. गॉट इट. ये सुप्रास्पाइनेटस, इनकम्प्लीट टेयर ऑफ सुप्रास्पाइनेटस है. इसे इसके लिए कोई ऑपरेट नहीं लगता. आप बिंदास अच्छी तरह से ट्रीट ये कर सकते हो. सुप्रास्पाइनेटस टेंडिनाइटिस, इट इज़ एम्प्टी कैन टेस्ट. सब लोग एक बार वापस ऐसे करो और नीचे कर दो. दिस इज एम्प्टी कैन टेस्ट. एक ही पर्टिकुलर मूवमेंट जिस वक्त मुझे पेन होता है, दैट इज सुप्रास्पाइनेटस टेंडिनाइटिस. उसमें दिस इज सब एक्रोमियल बर्साइटिस. सब एक्रोमियल बर्साइटिस में भी एक्सक्रूशिएटिंग नहीं पर स्पेसिफिक कुछ मूवमेंट करते वक्त अचानक पेन होता है. There are only 10% cases of bursitis where it is infectious. इन्फेक्शन हुआ बर्साइटिस में तो उसकी ट्रीटमेंट बदलती है. बाकी सभी ट्रीटमेंट आयुर्वेद से अच्छी तरह से हम ट्रीट कर सकते हैं. इसमें भी अग्निकर्म विद्ध 26 नंबर की नीडल लेके आपको विद्ध कर्म उसमें करना है. काफ़ी अच्छा रिजल्ट, पेन एकदम कम हो जाता है उसमें. क्रैक फ्रैक्चर, उसमें आपको बंध बांधना पड़ेगा. थोड़े दिन स्लिंग दिया जाता है उसके लिए 45 to 50 डेज मिनिमम फॉर 3 months ना. आपको भग्न से रिलेटेड ट्रीटमेंट करनी पड़ेगी अगर अपर लिम्ब है तो. इफ़ इट इज़ लोअर लिम्ब go for 4 months of treatment related to भग्न चिकित्सा. 3 महीने ऊपर 4 महीने नीचे आपको ट्रीटमेंट करनी है और आपको अच्छा रिजल्ट मिलेगा. एकदम कॉन्फिडेंटली ट्रीट करो. कोई अच्छा ऑर्थोपेडिक सर्जन तुरंत सर्जरी नहीं बताता शोल्डर जॉइंट के लिए. याद रहे, बैग ऑफ बोन्स भी रहे, छोटे छोटे टुकड़े भी हुए ना बोन्स के, तो भी अच्छा सर्जन रुकता है, पेशेंस रखता है, अपने आप हील होने देता है. ये जॉइंट, ये जो शोल्डर जॉइंट है, ये बहुत वाइज जॉइंट है बॉडी में. ये ऐसे ही नहीं बिगड़ता. इट हैज़ अ वेरी गुड सेंस ऑफ हेल्थ. वो अच्छी तरह से खुद हील होने पे भरोसा रखता है. इसीलिए याद रहे, ये ट्रीटेबल है, आप इसे ट्रीट कर सकते हो. केस स्टडी नंबर 2, फीमेल 57 years old, sudden onset of severe pain, tenderness over rotator cuff, pain disturbing sleep. क्या है? एक्सक्रूशिएटिंग पेन. पेशेंट ऐसे ही आता है हाथ लेके, हमें लगता है ये एंटीरियर डिसलोकेशन ऑफ शोल्डर है, पर ये नहीं है एंटीरियर डिसलोकेशन. ये सिर्फ रेडियोलॉजी से ही आप इसको इवेल्युएट कर सकते हो. और ये है कैल्सिफाइड डिपॉजिट. एक ऐसा छोटा सा टुकड़ा वो टेंडन के अंदर अटक जाता है और बहुत बहुत ज़्यादा पेन होता है पेशेंट को. तो ये भी याद रखें. अभी मैंने जिस बुक का जिक्र किया, शैडोज टू डायग्नोसिस, वो अभी नेक्स्ट मंथ वैक में हम लोग शायद प्रेजेंट करेंगे. उसमें भी ये है, ये स्पेसिफिक कंडीशन. ये सी द डिफरेंस बिटवीन 2 एक्सरेज. दिस इज यहाँ पे जो है, वो जो आर्टिकुलर सरफेस आप देख रहे हो, वो यूनिफॉर्मली डैमेज्ड है. सभी जगह से ऐसे अंदर आ गया है. दोनों बोन जो है वो सभी जगह से एक जैसे चिपके हुए हैं. इन केस ऑफ दिस पर्टिकुलर थिंग, असिमेट्रिक डैमेज है. Symmetric damage is related to rheumatoid arthritis. First is of rheumatoid arthritis. Second is related to osteoarthritis. Symmetric and asymmetric damage. Bilaterally affected, it is mainly rheumatoid arthritis. Wasting of deltoid, ये shoulder contour रहता है ना, वो एकदम ऐसे flatten हो जाता है. And flattening of shoulder contour. ये पहचानते हो आप इसे? मैं जहाँ प्रैक्टिस करता हूँ, यहाँ पे रहता है वो शिवाजी पार्क में. मैं ट्वाइस अ मंथ जाता हूँ. ही इज़ मिलिंद सोमन, टॉप का मॉडल है ये. अगर इसके साथ सेल्फी खिंचवानी है ना, तो वो रास्ते पे ही वो दौड़ता रहता है, नंगे पाँव वहाँ पे दौड़ता है वो. और वो काफ़ी 20-25 किलोमीटर ऐसे आराम से दौड़ लेता है. तो अगर इसके साथ सेल्फी खींचनी है तो आपको 25 पुशअप्स मारने पड़ते हैं वहाँ पे ही, फिर वो सेल्फी देता है. इट्स अ वेरी फिट पर्सन. आपके पास ये पेशेंट बन के आया तो आपको बहुत अच्छी तरह से उसको ट्रीट करना पड़ेगा. सो पढ़ाई करनी पड़ेगी. ऐसी केसेस अभी आ रही है आयुर्वेद में, और हमें बहुत अच्छी तरह से इनको ट्रीट भी करना पड़ेगा. ही इज़ अ वेरी गुड स्विमर ऑल्सो. फ्लैटनिंग ऑफ शोल्डर कंटोर, इसमें 3 चीज़ें देखिए. शोल्डर जॉइंट का पेशेंट देखते वक्त याद रहे, उसका शर्ट पहले निकालो और देखो. बाकी लोग एग्जामिन नहीं करते, आप एग्जामिनेशन पे जोर देना. आप एग्जामिनेशन अच्छी तरह से करना. अगर पेशेंट शर्माता है तो तुरंत उसको बोलो दूसरे डॉक्टर के पास जाए. आप अच्छी तरह से एग्जामिन करो. एग्जामिनेशन ये आपका सबसे बढ़िया टूल है. एग्जामिनेशन इज़ वेरी इंपॉर्टेंट इन केस ऑफ शोल्डर जॉइंट. सो एक्सिलरी नर्व इंजुरी, ग्लिनोह्यूमरल डिसलोकेशन एंड ट्यूबरक्यूलोसिस, these 3 things are there. सो ये टीबी हो सकता है, फ्लैटनिंग ऑफ शोल्डर कंटोर. ये देख लो और फिर उसके हिसाब से आप ट्रीटमेंट बता सकते हो आगे. केस स्टडी नंबर 3, मेल 59 years old. ये फ्रोजन शोल्डर की केस है. यूनिफॉर्म लिमिटेशन ऑफ ऑल मूवमेंट्स. नेक्स्ट, फ्रोजन शोल्डर और ऑस्टियोआर्थराइटिस में क्या फ़र्क है वो इसमें दिखाई दिया है. अलग अलग पेशेंट में ट्रीटमेंट अलग अलग होगी, अलग अलग डायग्नोसिस के साथ ट्रीटमेंट अलग अलग होगी. 3 चीज़ें बताना चाहूँगा. शोल्डर जॉइंट की केस में क्या करते हैं? स्कंध, आप हाथ रखो स्कंध पे. आपने स्कंध, वक्ष, त्रिक स्कंध वक्ष त्रिक प्राप्तम वायु मन्यागतम तथा, ये वायु स्कंध वक्ष त्रिक प्राप्तम वायु मन्यागतम तथा वमनम हंति नस्यम च, पहले वमन दो ये पेशेंट को। एक्स्ट्रॉर्डिनरी सूत्र है ये। वमन कोई नहीं देता शोल्डर जॉइंट के पेशेंट को, आप देना चालू करो, क्योंकि बाहर नॉन ट्रीटेबल शोल्डर जॉइंट बहुत है जो आप ट्रीट कर सकते हो विद द हेल्प ऑफ वमन, और उसके बाद नस्य चालू करो। मैं बहुत पेशेंट को वमन देता हूँ, शोल्डर जॉइंट ट्रीट होता है। जो ट्रीटेबल नहीं है ऐसे बोलते हैं वहाँ पे भी, और ये मैंने बोला वो वमन दिया और उसके बाद आपने बस्ती दिया तो ही फायदा होगा। बस्ती उसके पहले दिया तो फायदा नहीं होता। ऊर्ध्व शोधन के बिना दिया हुआ बस्ती इज अ फेल्यूर। तो वातव्याधि है इसलिए मैंने बस्ती दिया, इट वोंट वर्क। वमन स्कंध वक्ष त्रिक प्राप्तम वायु मन्यागतम तथा वमनम हंति नस्यम च कुशलेन प्रयोजितम। याद रखो, और ये ना अपने दिल पे लिख लो ये श्लोक, ये सबसे इंपॉर्टेंट श्लोक है इन केस ऑफ शोल्डर जॉइंट क्लिनिक। और एक एक्स्ट्राऑर्डिनरी सूत्र है, ये है सुश्रुताचार्य का, ये बोल के मैं 5 मिनट में बंद कर दूंगा, और वो है बाहुशोषे च केवले अनिलजे। बाहुशोष तो अनिलज है, वातज है, अपितु अवस्थावशात सिरावेदहा। सिरावेद करना चाहिए? द आंसर इज यस। आचार्य सेज सिरावेद यही करना चाहिए। क्यों? तथा ही उष्णांबु लवणादेहे वातहरस्य उपयोगात। पेशेंट दूसरे वैद्य के पास, डॉक्टर के पास जाके बहुत गुग्गुल कल्प वगैरह खा के आया है, बहुत लवण आदि कल्प खा के आया है, बहुत उष्णांबु आदि चिकित्सा करके आया है, वातहर, जिसकी वजह से कुपितेन शोणितेन, जिसकी वजह से शोणित कुपित हुआ है, रक्त कुपित हुआ है। आवृतो, उसने आवरण बनाया है वात का, वात पे। शोणितेन, शोणित का आवरण हुआ है। विच इज यदा वेदनाकारी, विच इज एक्सक्रूशिएटिंग पेन, यदा वेदनाकारी तदा सिरावेद इति। क्या सुंदर सूत्र है, ये एक्स्ट्रॉर्डिनरी लिखा हुआ है। बाहुशोषे च केवले अनिलजे अपि अवस्थावशात सिरावेदा। 2 बाहुशोष इज अनिलज, आपको सिरावेद करनी होगी। वो अवस्थानुरूप की जाने वाली वेगावस्था की सबसे बेहतरीन ट्रीटमेंट है। इट हैज गॉट टेम्पररी इफेक्ट, इट इज नॉट अ परमानेंट ट्रीटमेंट, बट टेम्पररी इट हैज अ फैंटास्टिक रिलीफ, फैंटास्टिक इफेक्ट। क्योंकि उष्णांबु लवणादे से जो रक्त खराब होता है वो आवरण बनाता है वायु पे और एक्सक्रूशिएटिंग पेन करता है। सो दैट इज द ट्रीटमेंट। तो ये 3 सूत्र है शोल्डर जॉइंट रिलेटेड, जो आप यहाँ पर बिठा लो और फिर यहाँ से बाहर जाओ। इसके बाद नहीं सुना कुछ मेरा तो भी कोई प्रॉब्लम नहीं है, हो गया है बाकी का लेक्चर। ये अभी आप दूसरे किसी से सुन लेना, ये मैंने सुबह भी बताया। ये एक सुप्रास्पाइनेटस टेंडिनाइटिस, अभी मैंने कहा वो एक पेन व्हाइल रेजिंग द आर्म फॉरवर्ड, साइडवेज और अबव शोल्डर हाइट, weakness when lifting up an object and burning sensation in shoulder, it is supraspinatus tendinitis. Tendinitis is related to स्नायु अनिल, मतलब स्नायुगत वात। भाव प्रकाश में है शूलम आक्षेपकहा कंपहा स्तंभहा, ये 4 लक्षण दिखाई देते हैं जिसमें बहुत अच्छी ट्रीटमेंट भाव प्रकाश में बताई गई है। ये नहीं देता हूं मैं कुछ अभी, इसका फायदा नहीं है आपको अभी, इसीलिए इस पे काम नहीं करेंगे। हम दूसरा देते हैं। आम परीक्षा। आम किस तरह से होता है? अजीर्णजन्य होता है, दुष्ट रसज होता है, लीन दोषज होता है। स्टीरॉयड डिपेंडेंट केसेस में लीन दोषज आम होता है, विषज आम होता है। सोरियाटिक आर्थराइटिस में विषज आम देखा जाता है। बहुत सारी दवाइयाँ लेने के बाद मल संचय ज आम जो होता है वो प्रमेह में होता है। प्रमेह में मल संचय जन्य आम होता है। इन सब की आम की चिकित्सा, आम का पाचन, ये सब अलग अलग है। अगर पेशेंट मलसंचयजन्य प्लस लीन दोषज है, डायबिटिक पेशेंट है प्लस रूमेटॉइड आर्थराइटिस है प्लस स्टीरॉयड लेने वाला पेशेंट है, तो ये मलसंचयजन्य और लीन दोषज आम है, जिसमें स्वर्ण भूपति जैसे कल्प दिए जाते हैं आम पाचनार्थ। वहाँ पे शुंठी अजमोदा काम नहीं करता, ये याद रहे। अजमोदा अच्छा नहीं है, बहुत अच्छा है, शुंठी इज ग्रेट, ऑफ कोर्स ठीक है, पर वो उस चीज़ में नहीं जहाँ पे लीन दोषज आम है। वहाँ पे आपको अलग अलग बड़े भस्मों का प्रयोग ये करना चाहिए। लीन दोषज, मल संचयजन्य और दुष्ट रसज ये कैंसर में पाए जाते हैं ये आम, इसके लिए आम पाचन अलग लगता है, वो नॉर्मल करके फायदा नहीं है। Case study number 5, history of injury, history of any disease, avascular necrosis of humeral head, senility. ये है osteoarthritis. Very rare, very rare. If you are having trauma related history, then only you get osteoarthritis of shoulder joint. ठीक है? Osteoarthritis का patient आपके पास आता है, पर remember one thing, it may be of कफज। पेशेंट आपके पास पहले 30 दिन में आया कि मुझे शोल्डर पेन है या मुझे नी जॉइंट पेन है, तो उसमें शोथ रहेगा, कम पेन रहता है पर शोथ ज़्यादा रहता है, अग्निमांद्य रहता है, ये कफ प्रधान संप्राप्ति है। कफ पित्तज नेक्स्ट, पित्तज थर्ड, फोर्थ इज पित्तवातज एंड लास्ट इज वातज, जिसमें अस्थि क्षय, संधिशोष, ये सब अस्थिशोष, संधिशूल, मांस बलक्षय ये सभी दिखाई देते हैं। ये अभी मैंने सुबह ही सिखाया, इसलिए अभी इसके पीछे नहीं जाता हूं। 4 कैटेगरीज इन संधिगतवाद। आमावस्था, बाह्य रुक्षण, अभ्यंतर रुक्षण आपको करना पड़ेगा। पहले पेशेंट आया, आपको बाह्य रुक्षण देना है, अभ्यंतर भी रुक्षण ही करना है, वालुका पोट्टली स्वेद करना है, अंदर से भी रुक्षण देना है। कफ पित्तज अवस्था, बाह्य रुक्षण, अभ्यंतर स्नेहन। पित्त वातज अवस्था, बाह्य स्नेहन, अभ्यंतर रुक्षण, और वातज अवस्था, बाह्य स्नेहन, अभ्यंतर स्नेहन। इस तरह से आपको संधिगत वात स्लैश ऑस्टियो आर्थराइटिस ट्रीट करना होगा। ये सिर्फ एक तरीके से करके फायदा नहीं है। मसल वेस्टिंग रहा, कुरिया संधिगत दाह स्वेद उपनाहनम, ये आप परम्यूटेशन कॉम्बिनेशन करके ये यूज कर सकते हो। मसल वेस्टिंग रहा तो याद रखिए, तैलम संकुचिते अभ्यंगो माश सैंधव साधितम, माश तेल करके आता है। अगर मसल वेस्टिंग आपने देखा, जैसे मैंने क्वाड्रिसेप्स मसल वेस्टिंग बोला था अभी सुबह भी, अगर मसल वेस्टिंग देखा तो यूज माश तेल। ये मर्म चिकित्सा है। अभ्यंग स्वेदन, नस्य, स्नेहपान, सिरावेद, मर्म चिकित्सा, हर एक का खुद का अपना एक इम्पॉर्टेंस है। Importance of रचनाचार्य, modern diagnostic tools, clinical examination, specific procedures, Ayurvedic निदान and Ayurvedic चिकित्सा. These are most important things just we are talking about. ये टेक होम मैसेज था। ये अभी ये ख़त्म हुआ, ये बुक अभी बहुत लोगों ने ये लिया और ख़त्म हो गया अभी। ये आप कभी भी मुझे फ़ोन कर सकते हो और हम लोग केसेस रिलेटेड डिस्कशन भी कर सकते हैं। थैंक यू ऑल फॉर पेशेंट लिसनिंग। और चेयरपर्सन, को चेयरपर्सन सर, प्रिंसिपल सर, मुझे जिन्होंने बुलाया वो सभी लोगों का मैं बहुत शुक्रगुजार हूँ। और आप सभी लोगों ने भी बहुत शांति से, इट इज़ वेरी डिफ़िकल्ट, खाने के बाद कोई सेशन नहीं सुन सकता। अच्छा खाना हुआ तो उसके बाद आदमी फ़ैन कहाँ पे है वो देख के आराम से सोता है। तो ऐसे वक्त भी मैंने यहाँ पे 10-20 लोगों को तो ऐसे सुनते हुए देखा है, ये काफ़ी है। और आप सभी लोगों ने ये सुना, इसीलिए मैं आप सभी लोगों को थैंक यू कहना चाहूँगा। थैंक यू ऑल।
Dr. Basumatari, should you conclude? Yeah. So with this, the session is concluded, and I think the organizers are ready for the valedictory function. So with many thanks to the speakers, all the speakers, and the organization.
Friends back. No. It's okay. Gamsasana. Also, I request Dekasa to felicitate with Gamasa, our chairpersons. Now I request to felicitate our co-chairperson. Sir, we go to name? Go to name? Did episode. So thank you all. So I request all the
Honorable Professor Devendra Jaihal, sir. He's a director, IITG. I welcome you, sir, to our valedictory session. Sir. Today we have among us our Honorable Principal, sir, Professor Pranabjyoti Boisya, sir. He will preside over the meeting. Sir, I welcome to our valedictory session. Sir, please. I would like to invite Professor Dr. Khogen Bosumotari, sir. He is the president of this national seminar and Northeast coordinator, Biswa Ayurved Parikhad. I welcome you, sir. Today we have among us respected Dr. Aurobindo Das, sir. He is the president of Ayurvedic Medical Organization, AMO Assam. I welcome you, sir, to this valedictory session. Now, I would like to request our dignitaries to go for lighting of the lamp, and I would like to request our students to assist the program. Sir.
श्री भगवान धन्वंतरी वंदना नमामि धन्वन्तरिमादिदेवं सुरासुरे वन्दितपादपद्मं लोके जरारुग्भयमृत्युनाशं दातारमीशं विविधौषधीना तव्योमवातावनिवारिवह्निं पञ्चप्रपञ्चात्मकदेहभाजम् सन्तापसम्पातजराज्वरान्तकं नमामि धन्वन्तरिमादिदेवं नवीननीलमुदकान्तिकान्तं शान्तं हरिद्वादशाख्यमूर्तिं पूर्तिशतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवं नमामि धन्वन्तरिमादिदेवम्
Thank you. Next, I would like to request Dr. Vivek Sharma to felicitate our Honorable Principal Sir, Professor Dr. Pranav Jyoti Vaishya. Now I would like to request Professor Bimal Lekha sir to felicitate our Honorable President, Organizing Committee, cum Coordinator, VAP, Northeast Region, Professor Dr. Khogen Basumatari. Thank you, sir. Now I would like to request Dr. Meenal Vaishya to felicitate President, Ayurvedic Medical Organization, respected Dr. Aurobindo Das, sir. Thank you, sir. Now I would like to request our respected Dr. Vivek Sharma to felicitate Professor Dr. Jyotirmoy Sharma. I would like to request Dr. Vivek Sharma to felicitate our respected Dr. Sokreshwar Haloi. Now I would like to request Dr. Poonam Sharma to felicitate our respected Professor Dr. Bimal Lekha sir. Now I would like to request Dr. Binoy Sen to felicitate respected Dr. Nitin Varman sir. I would like to request Dr. Olokesh Mojumdar to felicitate Dr. Hemen Kolita. I would like to request Dr. Moniruddin Dewan to felicitate Dr. Jyoti Boro.
Key person of this seminar, what we are today, what is today, last 2 days, what is the gathering. He has taken lots of effort to make this event successful. We want to congratulate him and we want to felicitate him on DICE. Please come, sir. So we'll felicitate. I will request our chief guest, Director IIT, sir, to felicitate him with a Phulam Gamosa and a Pride of Rhino. Please, Biswajit, sir. Thank you, sir.
Good evening to good evening to everybody. Our most respected chief guest of this today's meeting, the director of IIT Guwahati, my friend and the professor of Samhita department, Dr. Khagen Bosumatari, and of the dais, my friend Dr. Vimal Deka, Dr. Yanbani Hansoy, our most respected Dr. Dilip Goswami, and our most respected, the pioneer of Ayurvedic industries in Assam, our proprietor of Vajranga Ayurveda, and the administrative staff of IIT Guwahati, and my most respected faculty members and my old students in front of me, and my dear friends along with them also, and the students, both undergraduate and postgraduate of this college, and all these members of print and electronic media and our technical staff. So it gives me immense pleasure to welcome you all in this valedictory function of this seminar on recent advancement of Ayurveda. And we have come across almost 2 days. Yesterday starts from 9:30 a.m. to till now it is around 4:47 p.m. So, and in this period we have gained our knowledge in recent advancement in this seminar. All this I thankful to all those participants, those who have got experience to gain knowledge in that seminars. And lastly, from the principal of this college, from my deepest corner of my heart, I welcome the office bearers from the president to secretary of AMO group, from Dr. Aurobindo Das to Dr. Vishnu Chaudhary, and all these lowest and newly joined AMO members, and the members of our Vishwayarved Parishad, and all the faculty members of our college, and members of our medical officers group, members of library, members of DTL staff, and members of our internee doctors and postgraduate scholars, and all staff of our college. I welcome you all in this felicitative function. Thank you.
We have among us Honorable Sri Dharmananda Borua sir, ACS. He is the PPS to Honorable CM Govt of Assam. I would like to invite sir to take his chair. Sir, please. I would like to request Dr. Aurobindo Das to felicitate Sri Dharmananda Borua sir.
Next, I would like to request Professor Dr. Khagen Basaramatari, the President of Organizing Committee of this national seminar, to give some specific thoughts in that meeting.
Good afternoon, one and all present out here. The respected chief guest of this valedictory function of National Seminar on Recent Advancement in Ayurveda, Professor Devendra Jalial sir, the Honorable Director of IIT Guwahati, the respected Principal Government Ayurvedic College, Professor P.G. Besya sir, guest of honor Borua sir, and our most respected the President of AMO Aurobindo Das sir, and of the dais BP ma'am, Goswami sir, and our invited guests, all the participants coming from all across the country, all the workers of AMO, and all the medical officers and practitioners who are participating from all across the state, all our PG scholars, UG scholars, and all other ladies and gentlemen. So this is the end part of this two-day national seminar on recent advancement in Ayurveda. So in this seminar, so almost 450 participants from all across the country, from 18 states participated. And we received almost 150 papers, and all presented, and more than 20 posters. And for this seminar, for the plenary session, we invited some resource persons who are expert clinician, who are expert in different specialty, and they are very renowned in practice, like dermatology specialist, hepatobiliary specialist, then orthopedics, and one resource person who is applying all the fundamentals which is described in the classics of Ayurveda, like Sorok and Susrut. So in a clinical field, he applied the fundamentals and treated, and he has showcased almost more than 1,000 cases on diabetic, how he applied the fundamental. He took of course, he took the help of modern MRTs in the diagnosis, but purely applied the Ayurvedic algorithm of treatment and Ayurvedic medicines, and he has shown the results. And I think all our participants got exposure in this clinical experience, who has shared from their field to this platform. And with this knowledge, I hope our participants has enlightened and they will apply in their practical field and will be benefited and give benefit to the society. So science is a dynamic, and the theories and ideas always change and develop. So it's a frequently asked question that Ayurveda is as old this time-tested medicine, whether for that updation is required or not. So in Charak, there is a reference in Jadavada Thangsa, Yuge Yuge, the dharma is decreases, all the qualities of the substance, what you use, in due course of time, it decreases. That's why, as per the new hour, that that treatment principle and treatment, that medication and the research is required for development, for updatation. And that's why we have kept the topic, theme, recent advancement in Ayurveda. And surely, by sharing experience of the resource person, we have obtained the developments in the various fields which I have mentioned. And in this seminar, we have kept 27 thematic sessions, and that 27 theme we organized in 14 sessions, in different sessions, and they are also, we kept the topic like musculoskeletal to obesity, and then pharmaceutical. Apart from the disease, we kept the food and nutraceuticals, the bioeconomy of food and nutraceuticals, and bioeconomy of flora and fauna, which is existing in the northeastern region, because northeastern region is rich in flora and fauna. How we can harvest those things and you can utilize in our day-to-day life. So, as a organized president, I can say that this seminar is a grand success, because after the Platinum Jubilee last year, which we organized, this is a mega event in a national level. We organized this and successfully is a grand success. And this success is because of the day in, day out hard labor of all our faculties, all our PG and UG scholars, all the workers from the AMO, all the workers from the Vishwa Ayurveda Parishad, and all that other stakeholders who are contributing in this seminar. So I thank you from my core of heart, those participants. I think our participants who are coming from the outside, they will take the good take-home message, and they will utilize in their field and get success in life. Thank you.
Director IIT sir, respected Principal Boisu sir, President Assam Medical Association Aurobindo Das Dangoria, our Khogen Bosumutari sir, respected Vice Principal Madam, respected invitees, students, delegates who have come to attend this national level seminar, I thank you for inviting me to grace this valedictory function today. This is my second visit to Government Ayurvedic College in frequent succession. I came last on Dhanvantari Devas. I came quite late because the following day your inspection and some other issues were there. But while coming to attend this valedictory function, I went through the brochure which was brought out in consonance with this celebration, I mean the national seminar. The seminar mainly was to give you the recent updates about the development in the field of Ayurveda, especially the clinical practices, as I have been given to understand, and the issues, sub-issues. I went through the sub-issues also. It encompasses a wide and vast area, including medical tourism, pediatric care, critical care, geriatric care, cancer care. So, this 2-day long occasion, which was attended, I have been given to understand by as many as delegates from 18 states. They must have enriched themselves with a lot of informations, updates, and this will definitely help them in honing their professional skills and in furthering their efforts in research and development in the field of Ayurveda. Although I am not related to the field of medicine, Ayurveda, but I am an administrator. As I have been introduced to you, I belong to the Assam Civil Service cadre, and I am right now working as the Principal Private Secretary to the Honorable Chief Minister Assam. I have been working with the Honorable Chief Minister for the last almost 22 years. While he was the Minister of State, I started with him as an officer on special duty. Thereafter, I worked with him as the Cabinet Minister in charge of Health Department. And still today, our Honorable Chief Minister Assam is holding the portfolio of Health and Family Welfare Department. So during his tenure at the Health Department, at the helm of the Health Department, you can say, the health sector scenario in Assam has witnessed tremendous changes. A lot of institutes have come up, facilities, equipments have been provided, trust areas like cancer care, geriatric care, so many areas which were not touched earlier or which somehow for the one or the other reasons remain untouched have now been mostly touched. Under his able stewardship, the health scenario in Assam has undergone a drastic and tremendous change, and that is something which no one can deny. Personally, being with him and working under him, the change that has taken place is something which is very palpable, which is very tangible, and which can be felt so far as the health scenario in Assam is concerned. That is one aspect. Secondly, regarding the practices of the Ayurveda, system of Ayurvedic medicine, although allopathic system of medicine is generally sought after or preferred, but frankly speaking, and personally speaking, I would like to say, I still prefer to follow Ayurvedic system of medicines. I regularly have my ashwagandha, brahmi, giloy, and raw turmeric. Raw turmeric I used to take daily, and that is I am doing for the last, I don't know how many years, almost 20 years I am taking. So these are the benefits which I directly feel I am getting. And given the work schedule which we have to put while working in an environment like the CMO, Chief Minister's Office, and given our very, very energetic Chief Minister, so we need to be on our toes 24/7. And the mantra behind being able to run like our energetic Chief Minister is Ayurveda only, not allopathy. So those who have come from far-flung states, I hope they have got a nice exposure from this national level seminar. And they have also been able to visit the important places of tourism in our state and will go back with nice memories. I thank you once and again for giving me this opportunity to come and grace this occasion. Thank you very much. Thank you so much.
Thank you, sir, for your lecture, especially in relation with Ayurveda. Next program is the certificate distribution. And I'd like to request Dr. Niten Burman to coordinate this program. And will be finished within 10 minutes.
Dr. Mantu Das, if he is present over here, please come to the dais and take the certificate from our Honorable Chief Guest, sir. And next one is Dr. Alakesh Mozumdar. If he is present over here, please come to the dais. I think he is absent in the hall. So secondly, we had, along with a scientific paper presentation, we had one session for poster presentation also. So there were 21 posters presented by our students as well as students from outside. And we kept 3 positions, first, second, and third. So I like to announce the name of the first best poster, second best poster, and third best poster. If they are present over here, please come to dais to take their certificate of appreciation. First prize poster presentation goes to Miss Nargis Tapadar and her team, Miss Tasnima Yasmin and Mr. Sattar Ali Sheikh. I like to request Miss Nargis Tapadar only. Please come and take the certificates from our respected guest of honor, Sir Burwa, sir. Second is Miss Tamanna Nasrat Mozumdar. Miss Tamanna Nasrat Mozumdar. You will take your certificate from our principal, sir. In third best poster, again there is 3 students. Miss Kedichu Kerenoi Suno, Mr. Stephen Laldin Moya, and Mr. Gerald Tangseng. If you are present, please come and take your certificates from our Arvindo Das, sir. So I think Dr. Alakesh Mozumdar is present over here. Please come to the dais and take your certificate of participation from Khogen Bosumatari, sir. Please come. So without taking much more time, we have finished our certificate distribution program over here. And the rest certificate of participation will be given after completion of the valedictory session. So thank you, sir. Thank you, President, sir.
And today's specific program, it is the speech by our specific guest, is the Director of IIT Guwahati, Sri Professor Devendra Jalihal, sir.
Yeah, namaste. Distinguished scholars on the stage and among the audience, I'm singularly unqualified to stand here and talk about Ayurveda. However, as a long-standing student of Bharatavarsha, of Bharatiya culture, parampara, I would like to make some comments, right, on the what is now called Indian knowledge systems. In fact, I would like to state 2 or 3 stories. Right? The first 2 are from real life that I have been able to witness, and the third one is my hypothesis. So I come from Karnataka, right, very close to the Goa border, right, 150 kilometers is Madgaon, which is, the port. So my family members had gone on vacation to Goa. My sister, her husband, children, and all that. My sister had gone into the sea, and a big wave came and hit her, right? And she fell down. And when she got up, she was in intense pain, right? Her arm had got dislocated, right? Because of the sudden thing, the bone had come out of the socket, and she was in intense pain. My brother-in-law, who was a doctor, he was speechless. He didn't know what to do, right? There was a fisherwoman who was going, right? And she heard all these screams and everything, and so she came and asked what is happening. My brother-in-law said, she fell down and she's in intense pain, and from what I can see, her bones have come out, and I have to now take her to far away, 150 kilometers away. She said, if you give me a chance, I would like to see what is the situation. So this, illiterate fisherwoman came, just did something. Then she said, please allow me to, have a moment of pain for her. So she just twisted the bone, and the bone got back into the socket, right? And that's it. She said, this kind of things happens all the time. And we all know how to set the bone, right? So this, my doctor, brother-in-law could not figure out. And to this day, he's amazed at the confidence of the fisherwoman to set the bone straight, right? That's one incident about the parampara of our knowledge with ordinary people. Second incident, I would like to tell you that around 10 years ago, I think 2015 or 2016, I forget the time, a Chinese lady, right, who used to work in traditional Chinese medicine, right, got Nobel Prize for medicine, right? Her work involved, she had no fancy degrees. Today in China, it's not uncommon to see people with degrees from US and Germany and so on, but this lady did not have any such degrees, right? She was trained in the traditional Chinese medicine and in the modern microbiology and so on. There was a belief among the Chinese people that a certain herb is good for malaria, right? And in the modern medicine, quinine is the medicine that's given out for malaria. And so from 1975 onwards, for 40 years, right, she stayed with that problem, that why is this that the Chinese people believe that this particular herb is a good medicine for malaria. And she, carried out experiments throughout her life and found reduced this entire herb to molecules. Then she showed that these molecules are a better cure for malaria than quinine. And for her contribution, right, she was given the Nobel Prize. I mean, not very long ago, 2015, 2016. So, there is good in the traditional medicine, right? And this effect we have seen, right? I'll end with two more examples, right? When I was young, the Prime Minister of Sri Lanka at that time was Mrs. Sirimao Bandaranaike. So she had, arthritis. I mean, she was a big built, right? If you've seen her pictures, big built, and she had arthritis. She could barely walk. So from Colombo, she came to Kerala in a special plane, right? She had virtually had to be carried on a stretcher, right, to an Ayurvedic a clinic in Kerala. And she was there for 15 days. And believe me, she walked back. She had to be carried on a stretcher when she came. And in 15 days, her arthritis was managed reasonably and she could walk back, right? This was a big news, right, around 1970s. So, the efficacy is, set there. And you all have heard in the last 10 days ago or 10 days ago, the King of England, of all the people, he visited Bangalore, and it was news, and it said, no, this is not the first time he has come. Right? He has been coming, of course, sort of incognito, and he has been coming and taking treatment, right? And nobody knew about this. And most recently when he came during the Deepavali weekend, and everybody came to know that the King of England is there, visiting for Ayurvedic treatment, right? And so I don't need to, I'm not an expert, I can only tell you. So that leads to the question that other people also talked about, that is, what happened, right? What happened to this precious Indian knowledge system, right? So when the Britishers came, right, and that also, this is my hypothesis, but please forgive me if my hypothesis is wrong. And why is that? Ayurveda is preserved and practiced and still has popular acceptance in some parts, and in some other parts it doesn't have. And so I have a hypothesis on that. So when the Britishers came, one of the things they did, of course, people talk about their economic exploitation, and that's one side, like Gandhiji said, if you lose some money, you lost nothing, right? You can always get back the money. You just have to work hard and you'll get back the money. So, people focus on the economic exploitation of our country. I think that's okay. It happened, we all know. But more than that, right, they dealt a lethal blow to the self-respect of us, right? They said, you people don't know anything. You are ignorant. They demeaned, right, our knowledge, right, in all kinds of forums, right? And Indians for generations grew up with that feeling that we are worthless. We don't have anything to fall back on. We don't have anything which is our own, right? And so this was the reason why Ayurveda was demeaned and was not given the proper attention it deserved, just like the Chinese people could keep up with the research. And the second part of my hypothesis is that is the reason why in Kerala, in parts of Gujarat, which did not come under direct British rule, right? So all the Kerala thing that you see here came from what was then called sort of anglicized Travancore region. Travancore is Tiruvankur, anglicized to Travancore. In the Travancore region, it never came under British rule. Of course, they were, sort of controlled but the local administration stayed with the king, right? And there was very minimal interference with their intellectual tradition, right? And so there it grew. In Gujarat, some parts it grew. In Maharashtra, because till 1818 it was under the Peshwas. So in Pune and that region, Ayurveda was practiced and continued to be practiced, continued to be valued, continued to be, research was carried out. And so we need, of course, to adapt all ancient knowledge to modern systems. I mean, that goes without saying. But this research was not allowed, right? This research that was happening discontinued, right, because of historical reasons. But now I think we are on our own, right? I think there's no reason now to say that we can't claim what is rightfully ours. We can't, do research in what is ours. In IIT Guwahati, we have Indian knowledge systems, and it will be wonderful, right, if the larger Ayurvedic community of Assam and Northeast and IIT Guwahati collaborate in lots of problems, right? Either it could be isolating molecules, or it could be disproving some of the modern misconception, right? So Ayurveda uses some form of mercury, right? And in the Western medicine, mercury is like, poison. So anything to do with mercury, but Ayurveda people have been using it, right? In some micro form. So people are now saying maybe it is nanoparticles from mercury that are not harmful as the standard mercury. And the way Ayurvedic practices process mercury leads to, so I think all that research now has to happen, right? I mean, so we also have to dispel all this popular misconception has come about, right? And think there's a whole lot of work ahead of us that all of us need to carry out, and for that we just have to come together and do it. So thank you for giving me a patient hearing. Namaste.
So thank you, sir, for your blessings. So next I would like to request Dr. Biswajit Das to give vote of thanks.
Good evening, everyone. I'm honored to propose a vote of thanks on behalf of our organization for successful national seminar. First and foremost, I would like to express our heartfelt gratitude to our chief guest, Honorable Director, IIT G. I would also like to extend my sincere thanks to our guest of honor, respected Dharmananda Borua sir, to grace the occasion. I'd also like to express our heartfelt gratitude to our Honorable Principal Sir, Goft Ayurvedic College, Professor Dr. Pranabjyoti Boisya sir, to grace the occasion and all kind of help. I would also like to thank Dr. Aurobindo Das, President, Ayurvedic Medical Organization, without whom this program would not have been success. Our organizing committee has worked tirelessly to ensure smooth management. I am grateful for their dedication. I extend my heartfelt gratitude of thanks to all the resource persons, delegates coming from different centers of the country. I am thankful to the faculty of Goft Ayurvedic College, medical officer of Goft Ayurvedic College and Hospital, PG scholars, UG students, staff, and employees to extending their helping hand in every aspect. I would also like to thank media person for their helping hand in every aspect. Thank you all once again for your presence and support, and let's continue to strive for excellence in our future. মই আপোনালোক সকলোকেই পুনৰবাৰ আমাৰ চৰকাৰী আয়ুৰ্বেদিক মহাবিদ্যালয় গুৱাহাটী আয়ুৰ্বেদিক মেডিকেল অৰ্গেনাইজেশ্যন অসম তথা বিশ্ব আয়ুৰ্বেদ পৰিষদৰ ফালৰ পৰা আপোনালোকক ধন্যবাদ জনাইছোঁ। আৰু মানুহ মাত্ৰেই ভুল হয়, মোৰো হয়তো এইকেইদিন এই অনুষ্ঠান হয়তো চলাওঁতে মই জানি বা অজানি যদি কাৰোবাৰ অন্তৰত আঘাত দিছোঁ, মই তাৰ বাবে আপোনালোকৰ ওচৰত কৰজোৰে প্ৰাৰ্থনা জনাইছোঁ। আকৌ আমি সকলোৱে আকৌ লগ হ'ম, তাকেই আশা কৰি আজিৰ এই ভোট অফ থেংকছ অনুষ্ঠানটো ইয়াতেই সামৰিছোঁ। Now, I would like to request to stand all for our national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you. Now I would like to request our President sir to conclude the session.
So, thank you. And now I declare this program is concluded already.